Nursing issue, workplace violence. Misty Gomez, RN, Fort Hays State University. Workplace violence. What is workplace violence? Defined by Wolf, Altair, Delano, Perhatz, and Plains in 2014. Workplace violence in generally is defined as any physical assault, emotional or verbal abuse, or threatening, harassing, or coercive behavior in the work setting that causes physical or emotional harm. The community that involves are healthcare providers, physicians and mid-level providers, nurses, patient care techs, paramedics, EMTs, respiratory therapists, radiology technicians, and lab technicians. The types of violence involved can be physical assault with or without weapons, verbal assault, sexual assault and harassment, and intimidation. Where the violence occurs. Violence can occur in any nursing unit, any patient room, virtually any location at any facility. The highest rate reported is in emergency departments at 70%. Who commits the act? Patients, patient's family and friends, other staff members, or anyone at all in the department. Why violence occurs. Stress of the illness, psychiatric disorders, substance abuse, frustrations with long wait times, high situational distress, and retaliation of gangs and domestic abusers for helping victims. The community culture of nurses and the perception of the culture is underreporting. Nurses do not report or file occurrence reports because of unclear or lacking policies, poor managerial and administration support, and nurses have an opinion that the workplace violence is just part of the job while working in the medical profession. The social impact of the nursing and healthcare provider response can be injury, sadness, fear, anger, job dissatisfaction, post-traumatic stress symptoms, and anxiety. Consequences of workplace violence can include medical care costs due to injuries, psychiatric care costs due to sadness and anxiety, decreased productivity of the nurses, lost days of work, high employee turnover, and legal fees. Analyzing the issue and social impact. I surveyed 42 of my peers. 100% surveyed feel that administration and department directors lack compassion for staff as victims. 100% surveyed have encountered verbal abuse while providing care. 100% are concerned for their safety. 0 report having security or police in the ED at all times. 100% surveyed had patient family or visitors attempt to intimidate them. 98% surveyed report feelings of burnout with verbal and physical assault being a partial reason. 98% report knowing other healthcare providers leave bedside care due to verbal and physical assault. 88% survived physical assault. 12% of physical assaults had medical equipment used as a weapon, 0 had guns or knives used as weapons, and 16% report removing a weapon from a patient's possession. And only 2% have actually participated in active shooter drills. Recommendations for workplace violence is to promote a respectful communication, including active listening, mutual respect, honesty, trust, and zero tolerance framework. Policy is defined by what actions are tolerated. Policy is clearly understood and equally observed by all. Lateral violence is prohibited. Ensure ownership and accountability. Incidents should be reported immediately to the appropriate persons. Training and education on workplace violence. Focus on organizational and personal readiness, with skilled trainers who understand the audience and specific issues. Make sure to provide outcome metrics of the program's success. Top-ranked staff and patient safety scores, incidents of harm from violent behavior decreases. Entire organizations feel very safe when participating in these and hearing about these. Staff should feel comfortable reporting incidents involving persons of authority. Administration should be careful not to discourage staff members into pressing charges against anyone committing violence towards them. Other ways to prevent violence is to train staff for violence prevention and how to decrease escalation. Metal detectors at each entrance that provide patient access prevents weapons from entering the nursing area prior to any incidents. Security and police presence in emergency departments at all times. Mirrors, video monitoring, personal panic buttons, and having high visibility throughout the halls. Resources available for workplace violence include the following: ENA Workplace Violence Toolkit at www.ena.org, the U.S. Department of Labor OSHA Workplace Violence at www.osha.gov with the link provided below, American Nurses Association Workplace Violence with the link provided below, U.S. Office of Personnel Management Dealing with Workplace Violence, a guide for agency planners available at the link provided. Workplace Violence 911 Stop the Violence, available at www.workplaceviolence911.com, and Massachusetts Nursing Association Workplace Violence and Abuse Prevention, available at www.massnurse.org. Please see all the links below, and please don't be afraid to ask for help whenever you have been assaulted verbally or physically.